All right, everybody. Hi, this is Monica. I am so sorry. I apologize. This is Dr. Wanyoike. I'm going to let him introduce himself. But we are here at Omni Hotel, Chambers of Commerce Conference. So I couldn't have interrupted the conference. Dr. Wanyoike was participating in the panel, and that is why I'm late. So bear with us. But we're here now to talk about stroke, tumors, and head injuries. So, Dr. Wanyoike, please introduce yourself.
Thank you very much, Monica. My name is Dr. Peter Wanyoike. I'm a neurosurgeon in Nairobi, visiting Texas, and was privileged to be invited to the Chamber of Commerce.
Yes.
And now we are here. We will talk to you, our viewers, we'll exchange about brain tumors, stroke, and head injuries.
Okay, all right. Yeah. I'm ready for this. Do we have anybody that's coming on already? Okay. So anyway, let's get right to it. And, just tell us, why do young people nowadays, I think I know about maybe 3 people, very young people that have died. They had brain tumors and, cancerous. What happens? How do we get brain tumors?
Thank you very much, Monica. Now, brain tumors is a growth of abnormal cells in the brain, and it forms a mass of tissue, which we call a brain tumor. Now, brain tumors can grow either in children, adults. So they grow, both in adults and children. You find brain tumors in adults and children. Now, the ones you find in children some of them they are born with, so we call them congenital brain tumors.
Oh, Jesus.
Others that happen as the children grow, we call them, they could be malignant. And they occupy a certain part in the brain of the child at the back of the brain. But in adults, we say that you could either have a malignant tumors or benign tumors.
Okay.
Now, benign tumors are not cancerous, so to speak, and they cause problems by causing pressure, by enlarging. The malignant tumors could be the primary malignant tumors of the brain, like gliomas, or could be tumors that have come from another part of the body to the brain, especially the breast and the thyroid or the lung cancer, and we call those metastatic brain tumors.
Okay. So you're talking about cancer could spread from somewhere else to the brain.
Yes.
Okay.
Yes.
All right.
Yes.
Okay. What about how can somebody know that they probably have a brain tumor before they even go to the doctor? Would they be able to know, or do they have to go to the doctor, have tests done, and the tests will reveal that they have a brain tumor?
Some yes and some no. If you, for example, if you have a child who goes to school or a child who is starting to walk, or even a child who is small, and for the earliest sign in a small child is a enlarging head. You start seeing that the head is becoming bigger than the rest of the body for those children who are not able to walk. And if you go to your doctor, the child may, among other things, may have a scan done to look into the brain. In children, the other way you notice is that children start staggering. They walk like, they are staggering. Somebody who is drunk. You may not know, or they may be hitting the doors and the desks in class as they walk. They are not walking straight. So that is another early sign that may tell you this child may have some problem. The other one is not being able to see. A child who has been sitting in the middle of the class or all of a sudden can't see the blackboard, needs to come in the front. And as they grow bigger, they will start complaining of headaches, maybe feeling like they'll vomit, especially in the morning. And they may also have what we call a conversion or a shiza.
Okay.
So those would be the earlier signs in children. Now, In adults, the signs they vary.
Okay.
If a tumor is in front of the brain, they may present with change in behavior. Someone who has been responsible starts behaving, unresponsibly or inappropriately. So those, if they have people who care for them, instead of saying that they are mad or that there is something becoming big-headed, get a scan.
Yeah.
Of course, complaining of headaches, not able to talk properly if the tumor is compressing on the left side of the brain.
Okay.
If they start getting seizures and a new seizure, a conversion in an adult, that requires you to have a CT scan or a brain MRI done.
Okay.
But they also have the ones that present at the back of the head. So they may also present with issues of balance, loss of hearing, headaches and vomiting. So those are all signs that you may have a tumor in the brain. But also in adults,
while somebody is getting all these signs, would they be having a headache?
yes.
Okay.
Yes. That's why I said headaches and vomiting.
Okay, I missed that.
Yes. But brain tumors could also, spinal cord tumor could also spread to the spinal cord, especially in adults.
Oh, okay.
And you could also get primary tumors in the spinal cord. It's part of the nervous system. So, and it could be like the same, demographically, the same tumors that are found in the brain.
Okay.
So when we talk of tumors of the brain, we talk of the nervous system, we are talking of the brain and the spinal cord.
Okay.
Yes.
Okay. To have all these signs that you're talking about, it might affect gait, it might affect speech, eyesight, all that. Is it dependent on location of the tumor for all that to be affected?
True. That's dependent on the location. If it's affecting the eyesight, it's probably any tumor can affect the eyesight if it grows very big. But tumors, for example, what we call the pituitary tumors that grow between the nerves in the brain, affect the eyesight early.
Okay.
But there might be other signs that you're having that, like having excess secretions from the breasts, hormone changes, and so that will affect the sight early. Now, the tumors that are at the back of the brain affect your gait very early and hearing. Tumors that are on one side of the body, they affect the gait by causing weakness on that side. So people may say you have a stroke. Could be is a tumor that you're having.
I see.
And that is why getting an investigation and seeing a specialist is important.
Okay.
Yes.
Are all tumors do all cause death, or is there a treatment for it, or does it depend on how early it has been diagnosed?
Yes.
What is it?
Thank you very much. People think when you have a brain tumor, that's a death certificate. No.
Yeah.
A brain tumor is a growth like any other part of the body. And brain tumors, most of them are amenable to collection, especially if they are causing pressure on the brain.
Yeah.
However, there are some brain tumors which are malignant, which are in very critical areas, and especially depending on the age of that patient, you may not do much.
Yeah.
But tumors in young people, they are treated aggressively, so that you can have a tumor-free survival, and some of them will get to the cure stage. But there's a combination of treatment, surgery, especially for the malignant tumors.
Okay.
Surgery, radiotherapy, and chemotherapy.
Okay.
The benign tumors, once you have removed all of it, that's it. That's your cured.
Okay.
So, to have a brain tumor does not mean spell doom.
Okay.
What you should do is you discuss with your doctor.
Sentence.
It's not a death sentence.
Okay.
Discuss with your doctor about the possibilities of management, of treatment.
Yeah.
Have your fears allayed, and then you go on with the treatment.
Right.
Yes.
Okay. All right then. So if we can just jump into something else, if maybe we can now talk about stroke.
Yes.
Right?
Yes.
So walk us through, is it just a blood pressure that would cause stroke eventually if it's not managed? Tell us, how does it happen?
First of all, thank you very much, Monica. First of all, stroke is the death of brain cells. If you have it is like a heart attack. The way we talk of heart attack.
Yeah.
This is also call it a brain attack.
Okay.
And the good thing about having the stroke has is of two types, two major types.
Yeah.
We call it the ischemic stroke. The ischemic stroke is where a blood vessel is blocked.
Okay.
So blood does not reach the final part of the brain where it is supposed to go.
Right.
Then you have the hemorrhagic stroke, where you bleed. And you can either bleed into the brain, we call that focal bleeding.
Okay.
Or you can bleed over the whole surface of the brain, which we call subarachnoid bleeding. The worst is the subarachnoid bleed, because that may be because of a ruptured aneurysm, and that cures very fast. So, but if you have if you have a blood clot, it causes problem because of the pressure.
Yeah.
The primary injury you will not sort it out, but you sort out by reducing the pressure. You stop secondary damage that is caused by the pressure.
Okay. Thank you, Dorothy.
Yes. Be fast. Be fast is like I repeat there again for balance. If someone loses balance all of a sudden, is for the eyesight. Yeah. You start seeing black or dark images. F is for facial drooping. A is for the arm. Either the arm is getting weak or the leg is weaker. You can't walk. You can start in the chair. And S is for speech. But you start, your speech is no longer audible. You want to say something, but words are not coming out. T, which is very important for somebody who is ischemic stroke, is a time it takes for somebody to recognize that you are having a stroke. And they call, here you call 911, and you have an ambulance taking you to a stroke center. Yes. And once the people don't chew, they will say that you have a stroke. Yeah. But you said there's an emergency, so you'll be able to get the right treatment. And the good thing about that is that 80% of strokes which are managed within that time can be worse than the road procedure. So, even if your speech was gone, the beauty is that you can get intervention and the following day you are talking. Right? And then, of course, you need, but there are risk factors. And the risk factors, the major risk factor is hypertension. Uncontrolled hypertension. So, it is good for us to be checking our blood pressure maybe yearly. Take a 2-kilometer walk each day.
So exercise.
Exercise. Yeah. Eat healthy, so that your cholesterols are not high. High cholesterol, they block the blood vessels. So, and that will cause the arteries to cause the blood supply to diminish or to decrease. If you have other problems like diabetes, so look at this picture. High blood pressure, diabetes, cholesterol, those are very high. The highest in causing stroke. And of course, being overweight, so don't eat a lot of hamburgers with cheese, so they eat you. And walking is very important. So, and then, but for the hemorrhagic, that of course needed to be treated surgically, and you need to be taken to a hospital. Also immediately, that will take care of the surgical part of a hemorrhagic event. Yes.
You know, actually, somebody Modoni Batia commented here. She said, "What is the emergency number in Kenya?" In America, we call 911. What is the emergency number in Kenya?
Oh, in Kenya, you can either use the police line, the 999,
999.
or
It is
112.
999. Modoni. Let me just acknowledge a few people here. Teacher George, I can see you watching. Isaac Ben is watching. Jonathan. Isaac is watching from Minnesota. Yolanda, Dorothy is watching from Kenya. Kailsa, Pamboka, Susan. Thank you guys for watching. If you have any questions, just write your questions there because I'm looking to see if you have any questions. So maybe okay.
But there are also numbers. Currently in Kenya, the NHIF have partnered with the Red Cross. So the Red Cross emergency number is also very important.
Yeah.
And it is 0700 935 995. There is another organization called BSR Hospital.
Okay.
BSR Hospital is where I work, and I'm
Executive director.
Yes,
yeah, you should have said that. Executive
I'm very
director.
passionate about stroke, and we have an emergency number which is 0710 277 277.
Okay.
So with those numbers, if you call, you are likely to get some help. You'll be asked some questions to find out whether you really have stroke or whether you are just drunk a little bit. But once it is ascertained that you have a stroke, you will get the service. Yes.
What happens? Medication in Kenya is very expensive to some people. It's not affordable. I know I usually talk to my dad sometimes. You know, he's hypertensive. And I ask him, did you take your medication? And he will say, I usually wait until I have a headache, and that's when I know my blood pressure is high. Can you explain to the viewers what is happening if you are waiting until you have a headache?
Hypertension does not cause a headache. So do not wait for a headache. By the time you are getting a headache, it means that things are going well.
Yeah.
But of course, every headache is not a sign of a stroke. But the important thing here is that if you are at least know your family history, there is a stroke in the family, you know that you have been told maybe some time that your blood pressure is high and you have followed it up.
Yeah.
You know you are diabetic.
Yeah.
You know that you are overweight. You don't exercise.
Yeah.
You are the workaholic executive. Have a medical check.
Okay.
You are not useful to anyone. So, stay relevant, stay useful. Have a check and take your medication.
Brian, are you able to tag somebody for me? Do you know how to do that? Okay, can you tag WA space MA? She should come up. She told me to tag her and I forgot.
Alright, so...
Did she come up? Wama Hot?
Tag a friend, okay.
Yeah, tag a friend. Her name is WA.
No, I don't find that.
Huh?
I can't seem to find the option of tagging someone.
Okay, that's fine. Okay, let's go on. But she had, I think we are kind of finished with stroke, right?
Yes.
Anything else?
The only other thing about stroke is that we didn't need to talk about it because we need to educate our families, the ones who are listening. We need to carry this message across. We need to break barriers. We have cultural beliefs that a stroke is not an illness. We have believed that once you get some weakness, people will put you on the bed and start massaging you.
Yeah.
No, don't do that. A stroke is you only get useful treatment if it is within the hour maximum 3 hours. If you get treatment, if you have a stroke today and you say I'll go to hospital tomorrow, you can't be helped much.
Right.
So the message here is that early intervention for stroke and raising the awareness. If you have an idea, if you had heard this talk, raise the awareness to other people who have not heard about it. Let's talk about it in churches, in communities where we stay. In Kenya, it's of the non-communicable diseases. Now stroke is about number one. So it is like, but it is a problem. And it is affecting people who are in their productive life. So let us be useful to one another, like I say, and by talking about stroke, and remain useful by getting treatment.
Okay. Also, too, can you mention to our viewers how come when people get stroke, they may have weakness or paralysis on maybe the right side or the left side? Also, too, I think something else we need to explain to our viewers is that when you get stroke the first time and your right side, say for example, is paralyzed or a weakness on the right side, the next time you get stroke and get it on the other side of the brain, you have chances of getting the other side paralyzed or weakness too, right? Or how does that happen? Does that, like, to get paralysis or weakness of one side, is that also dependent on what side your stroke was?
Thank you very much. Monica, the brain is divided into the right side and the left side.
Yeah.
The right side of the brain controls the left side of the brain.
Okay.
The left side of the brain controls the
right.
right.
Yeah.
Now, the important parts of the brain are on the left.
Okay.
Your speech, your ability to write, your ability to recall and memory. Those are located on the left side of the brain. That is why people who get a stroke on the left side of the brain also don't, their speech is gone. The ability to recollect the things they have learned is gone. On the left, if you get a stroke and then the right side of your brain is weak, of your body is weak. If you get a stroke on the right side of the brain, your speech will still be there. Yeah? Despite the weakness on the left side.
Okay.
Now, if you are treated and you get cured, and then you don't follow up on your blood pressure medication, it's true, you can get a stroke. You can even get it on the other side.
Yeah.
But that is an issue. Again, with some weakness. The only thing is that there will be residual weakness. Even if you recover, you cannot recover completely. So you will get another stroke on the other side. Now, what will happen is that side will look stronger than now the other side, now this other side is weaker. And you will think you have recovered and then the other side, but that is an issue. But and again, the important here is that to get treatment for the stroke. True, a number of people, especially when you breathe, especially the subarachnoid, those people die. You just fall and you don't wake up. 50%.
Someone is saying not very clear on volume. Brian, can you come closer?
No, it's this thing that
we took that one off.
Oh, you took it off?
Yeah, we took it off.
Okay.
Yeah.
All right.
So we're just using that.
All right.
Yeah. So, okay. Gadoni, are we clear now? Can you hear Daktari? Daktari, say hello to Gadoni.
Hi, Gadoni. How are you? Yeah. Okay.
Gadoni, I need to know if you can hear. Okay, I didn't hear back from Gadoni. So, okay, we'll continue. We'll
Yes.
go on. Yeah. So you were saying about residual.
The residual weakness.
Residual weakness.
The residual weakness is
Better,
because,
okay.
yeah. So if you get a stroke, it makes the other side weaker. Now that residual weakness looks a bit stronger.
Okay.
But that is an issue
Okay.
which actually you can avoid by following your medications, by whether you're taking the blood pressure, whether you're taking the medicine to reduce the cholesterol levels, and whether you're working out to reduce it. Yes.
All right then. Okay, what about, I think I don't see anybody with a question about strokes, so maybe we can move on to the next thing. What about head injuries? Let's talk about head injuries. The reason why I actually wanted to talk about head injuries is because, next Saturday we will have domestic violence awareness. And I was just thinking that sometimes, people hit each other, with a baseball bat on the head, and I'm thinking that most probably people can get concussions out of that, just whatever head injuries people get. And most probably, some people will not even seek treatment for it. What happens is it possible that that same head injury, could cause problems in the future?
Thank you very much, Monica. Yes, head injury is any.
Hi everybody, I am so sorry. Our gadget went off, and the internet here is kind of giving us trouble a little bit as well. So we are back with Dr. And we had already discussed tumors and talked about stroke, and we were actually talking about head injuries. And Dr. I had asked you about head injuries. If somebody had a head injury, can it cause trouble or problems in the future?
Thank you, Monica, and viewers. Head injuries is anything that causes trauma to the head. That is one, or anything that causes an infection to the head that will also cause some head injury, or even surgery, even it causes injury to the brain cells. So now there are several kinds of trauma. We have minor and major trauma. Now, minor trauma will range from when you wake up from when you are cooking and you hit the kitchen table at the back of your head or on the side of the head, or something falls from the top drawer in your kitchen and hits you, or you are walking to the bedroom or to the toilet when you don't want to open your eyes and you hit the door to the bathroom quite well. Now, those especially in older people, because the brain shrinks with the age. So if there is a sudden stop, the brain moves. And when the brain moves, then there is a kind of the veins that connect the brain to the head rupture, and it causes a kind of a bleeding that we call a subdural hemorrhage. You may not notice it at that time, but maybe a month down the line, you start getting headaches, you start feeling as if one side of the brain is your body is weak. And if you go to the doctor, he may tell you, yes, you have a subdural hemorrhage. One of the other kinds of head injury that occurs is for people who play high contact sports, basketball, baseball, where you are running and you bump into somebody and you suddenly stop. That is called high contact sport, or even boxing. And people get mild forms of the brain injury because of this small repeated trauma. So at the time you may get headaches, and when you go to the doctor and he takes a scan, he may tell you that your brain is swollen, and you may get some medicine to keep it down. And sometimes you'll be advised to keep those kind of activities going. But of course, the other causes of acute trauma, domestic violence. Someone breaks your skull, for example, with a hammer or a baseball bat or something like that. Or somebody throws you against the wall or on the floor and you crack your head. That is a big violence. That's a big impact head injury. And once, if you have something like that, it is always good to get medical help. True. Road accidents, falls from height, right? those will cause acute trauma, may cause acute bad head injuries. Traumatic, the so-called what we call severe traumatic brain injuries may require you to be hospitalized in hospital for some time. Those high impact head injuries may also be accompanied by spinal injuries. So, and that is why there is all these rules about regulating the speed at which you drive, about wearing a seatbelt, and but let me address the issue of domestic violence, because that's a real thing, and it's a real thing in the sense that sometimes the anger when people argue in the house, your own, how you react to something that you have been told, how you react to things which are, or to emotions, that's very important. You know, it is because of the stresses that we undergo during the day. So some people are more amenable to reacting excessively than others. So domestic violence, if there is repeated trauma, if you have, every time you are beaten kidogo in the evening, I would advise you to seek professional help, whether it is counseling, because that can affect your life in the future. You may start getting conversion, and after some time, because of these repeated head injuries, you get other problems. I mean, for example, go into a depression, and you know, once you go into depression because of this repeated trauma, the cycle continues because you are also not able to defend yourself. So, to break the cycle, for example, in the cases of domestic violence, even if you're beaten, the very first day that happens, please seek professional help. Be talking when you have a professional help in the background. Don't wait until the time that you are in a hospital, you have had surgery, and then that's the time you can talk. No. And I hope that we'll keep on talking to stem that state of domestic violence.
Okay. Thank you, Doctor. I have a question here from Wamahat, and she is actually watching, and she wanted to say, I would like to know about degenerative discs, if there is any cure or just therapy.
Thank you very much, Wamahat. Degenerative disc on the spine. I don't know how old you are, Wamahat, but
she's probably asking for someone.
Yes, as we grow older, the degenerative, we get degeneration of our discs, like everything else grows, and even the act of degeneration happens. So if you get, if they are degenerating, and you happen to sit in a position, in a bad position, or you lift something that is heavy, that degenerated disc can burst, more like a shock absorber.
Okay.
A shock absorber, the way it bursts. And when it bursts, it releases some fluid. Shock absorber releases oil, but the oil flows. A disc releases some fluid, some jelly that hardens, like the tip of the nose, like a candle wax, when it comes out. Now that hardened jelly is the one that causes pressure in the nerves, and it starts irritating the nerves. So you have pain. If you don't do anything to it, the pain may become numbness, and the cycle continues. So it's but you can prevent that from happening. If it's another person or any person, we say don't carry heavy things. Unfortunately, because of our lifestyle, even people when they carry children, you have a children who is heavy and you need to nurse a child, you get this prolapse in children. But for our older folk, we always advise that to have like a corset if you have a small back problem.
Okay, so to have a corset, so you can
so
you can keep it straight and aligned.
Exactly.
Yeah.
Exactly. And even if you have you have a disc product that if it's not too bad, if you really don't have a lot of severe numbness on the leg, or if you're not having problems with your urine, you can still get the corset and you continue with your life. But there are times when you need to see the doctor because either the pain is too much, or the numbness is too much, and you may have a test called MRI, and you're told that hey, this disc is very big, it's causing problems, and you may have to have the disc removed surgically, which is a very safe procedure whether here or whether in our country.
So once you remove the disc, I guess so in other words, to answer Wamaho's question, is that there is help and there's treatment.
Yes.
Okay, so there's treatment, Wamahot, that's your answer. Okay, and then let me just ask another question here from George. Ask this question: should you be concerned when you have a headache? Does different head hemispheres ache? I guess different headaches, from different parts of the head have different problem symptoms. Why are some headache on the forehead, other at the back, others on either right or left?
Thank you very much. Who was that? That is a very good
George,
question.
yeah.
And that is directly addressing the headaches. Headaches is a very big topic by itself.
Yeah.
And you've heard of something that is called migraine headaches that usually affect the side of the head, the temporal sides, and they will usually they are beating with the heart, so they call it they are throbbing headaches. You may have other headaches which are in the forehead, and these are usually associated either with the sinuses. For example, during the weather changes, you may get sinusitis, or with your eyesight. If your eyesight is very good, is fading, you may have headaches that occur at the back of the head and on the neck. These are called mostly and may also may occur on the side. But if you have a headache that is associated with the neck pains, these are mostly like a tension headaches. And that headache may also affect the whole head, where you feel like, you're being squeezed. These are tension headaches, and you generally feel even your body is tired. So, yes, for headaches, you can get a headache on those sides depending on what kind of a headache it is.
Okay.
Yes.
Another question from Wamahat. She says, can a chiropractor help?
Yes, Wamahat. The science of the chiropractors, what they do is to try and touch various point receptors on your back, and they'll tell you they will realign the back. For most backaches, when there is no other pathology, it helps. If you have a disc product that is causing problems on your nerves, it will not help. So the most important,
temporal relief?
Is a temporal relief.
Yeah. Okay.
So for most people, if you have and probably that's what you need, a temporary relief to be able to go, but it's not cheap. Chiropractors are also not very cheap. The best thing is to understand your problem and what option you have. Yes.
All right, Wamahat, let me see what other questions she had. Okay, Wamahat, I'll make it happen. I think that's all the questions that we have. I don't see anybody else that has a question, but Dr. Ari is going to be here tonight. If you have any questions, definitely inbox me. Please do not send me your waving, because I'm not going to respond to that. But if you type your question, if you inbox me, I will ask him and I will inbox you back. Other than that, if nobody else has a question, then I think that's it. Richie, Saita, and Peter Tindi, thank you for watching. Wamahat, I will be talking to you later. I think that's all from us. Dr. Do you have anything else you want to say? And how can people get in touch with you? Anybody that comes to Kenya and wants, to probably seek treatment with you, how can they get in touch with you?
Well, we have a hospital called BSR Hospital that is in Nairobi, and the pilot line for the hospital is 0700 277
0700. What is the number again?
0700 277 277. Yes, please.
You guys, you had that. He is the executive director of BSR Hospital, and the phone number there is 0700 277 277. If you want to get in touch with Dr. Wanyoike, he is the brain and spine doctor. So I think we have covered everything that we needed to cover for today. Until next time, tomorrow I will be back with a domestic violence survivor, and we shall talk about domestic violence. She will tell you her story. Until next time, bye-bye. Thanks for watching.
Bye-bye.